In this video, we are going to demonstrate how to perform chest examination. Always communicate with patients before auscultation in such a way which reduces anxiety so as to gain their trust.
Important points you should know before auscultation.
Also ensure that all the necessary preliminary formalities such as history and biodata has been done. Need be inquire from patient if a support person is to be present. Is mostly appropriate when opposite gender is concerned. When you want to auscultate a blind patient, always speak to gain their consent and permission before doing it. Please put into consideration the people's culture in order to maintain trust and confidence already gained. Room or examination environment is warm, quiet, and reassures privacy and prevents unnecessary interruption.
Let's quickly understand what happens when we breathe and kindly watch.
What happens when patients breathe? When humans breathe in air, the smaller airways, that is bronchioles and alveoli, gets bigger, also known as dilation, to receive air, while the larger airways, that is the bronchi, gets smaller, that is it narrows, in order to force air downward. Then, during exhalation, the smaller airways contract together to force air out, while larger airways dilate to let air out of the trachea. Therefore, abnormal breath sounds result when any of these factors that cause decrease in compliance of these structures the above physiology.
To auscultate the lungs, place your stethoscope diaphragm in the following places on the client's chest in a systematic order. Ask the patient to breathe in and out while you listen. Make sure you auscultate all the points as shown on the screen. To auscultate the heart, place your stethoscope bell in the following places on the client's chest as shown on the screen: A, B, T, and M in a systematic order to listen to the heartbeat.